Hi family. This is Dr. Mo with Moya Body Care and Colon Hydrotherapy. And I am your favorite colon hydrotherapist that practices the sacred art of colon hydrotherapy, herbs, and natural living. This video is going to be a reality check. It's going to be a reality check. So I recently was working with a woman who pretty much considered herself done. Like she's out. She can pretty much care less. That was pretty much her attitude. She's in her 80s. She's on about 3 different hard pain medications. Like one is a narco, if you understand the strength of that. She's on 3 different ones. She's on about 2 different heart medications, a water pill. I mean, her list is gnarly. It's really, really, really gnarly. And she's severely constipated. Oh, she takes an over-the-counter like Rite Aid laxative daily. And she also takes a stool softener over the counter. Like nothing particular, just over the counter stuff. And so she calls me and she's like, I'm severely constipated. I can feel it moving the opposite way. I was told I was filled with poop. I need help. Can you help me? And I said, yes. However, you have been on severe pain medication that takes effect immediately. And it takes your pain away. You've been doing that for a while. I just want to let you know. And I told her this before we even exchanged money and looked at a calendar. I told her, colon therapy is water. Water has no chemicals in it. You've been constipated for over a year with narcotics that were prescribed that are acid-based. Do you understand what I'm saying to you? It's going to take time, and I understand that you feel you don't have time and everything, so I don't want to waste your time. But I just want to be very clear and transparent with you that all I'm working with on this side of the fence is water, breath, and intention. And all of that is predicated upon your willingness to accept it. I know sometimes pain is going to trump what I'm saying, and I get that, I understand that, but I need you to understand that this is not a quick fix situation. It's going to take about 3 months. Now, along that 3-month path, you should have some breakthroughs. I have had breakthroughs. I can't tell you how it's going to be for you, but I'm willing to work with you. You want to do it? She was like, I'll do anything. And I know for a fact she didn't hear anything I said. And I said, okay. So when she came in here, I set her in the front lobby. And again, I went over it. I understand you are in a lot of pain, but I really need you to hear me. That this is not going to be a quick fix thing. You're constipated. It's going to take a moment to shift that hard stuff out of your body. And you also have to remember, too, you are an older woman, meaning that your muscles in your colon won't be as strong, hence the reason why you have me here to help you out. So between you and I, we can rewind what has already taken place, provide some hydration to the body, give you some peace and gentleness in the inside so that you don't feel so raw. But it's going to take time. It ain't going to happen in one go. She was like, okay. I get her on the table. I expose her skin. This woman literally was like a piece of paper. If I were just to move her, she would have went. The level of dryness on this woman's body was unreal. So while she is hooked up to the colon therapy unit very slow because she's constipated, I go in massaging her legs and her feet because I can't take it anymore. This is, at my point, elder abuse in my eyes. This is elder abuse. So I start going in between her toes, and she's like, "Don't touch my toes." And I'm like, "What? What's wrong with your toes?" She's like, "Oh, I have neuropathy." I said, "Who told you that?" She's like, "The doctor." I said, "Hold on one second." I poured that castor oil in between them toes, and I got to working and moving that flesh around and massaging and getting that blood pumping through them feet. And I said, "Now wiggle your feet." She said, "What?" I said, "Wiggle your feet. Do your toes like this." She did it. She said, "Oh my God, it's a miracle." I don't mean to laugh, but the level of fantasy that we accept is unreal. It is unreal. I said, "Love, you don't have neuropathy." I said, "What you have is ashiness." That's not neuropathy. Ashiness can be cleared very gently with lotion. In your case, I would say castor oil. And she looked at me like, "Wait, what?" Speed it up, speed it up, speed it up to the colonic session. So she's starting to feel like things breaking up, and she's like getting uncomfortable, like her temperature has changed. She's a little flushed in the face. Now remember, she has all of these medications, 8 medications in her system, hardcore medications. All that stuff is going to come up to the surface, and she really don't want to be here. Like, she can care less. Like, she's pretty much given up. So I'm working with that type of energetic frequency, if you can understand what I'm saying. Finally, the body starts to push solid waste out. I'm going to show you something. The size of waste that came out of her was bigger than the circumference of this cup. It pushed the speculum out. In my head, this is elder abuse. She's crying and breathing. I'm breathing, trying to usher this poop baby out of this elder woman who was in her 80s. We get that out the way. I'm trying to deal with her feeling embarrassed, her feeling like she doesn't want to be here, her feeling like, "Oh my God, how did I?" It was so much in the air, on top of the toxicity of what came out of her. We get her to the restroom. She calls me in there. She's like, "Mo, I need some gloves. I gotta go digging." I get the gloves, come back. She's digging. She's in there for a cool minute. And she comes out. We talk about her care. And she goes home. A couple of days later, she calls me and she's like, "Hey, Mo, I haven't had a bowel movement. What do I do?" And I said, "I need you to follow the protocol that I shared with you. We have to go through this protocol every single day." And the protocol was just, specific diet, herbs, water, herbal laxative, etc., etc. But I got to do that straight for 14 days. You got to do it so we can break the stuff up. She pretty much threw it to the wind and was like, "This is not working for me. It's just water, etc., etc., etc. This is bull crap," and threw it away. What I know for sure is that colon therapy can work. I have seen it work. But you have to want to be willing to do the work. My name is Dr. Mo with Moya Body Care. And my website is Moya, MOYA, bodycare.com. And I will continue to be of service to you.